Professor Lance McCracken, are antidepressant medication perhaps the easiest or the most effective solution for depression?
This is you're not going to be surprised to hear that this is not an easy question to answer with a yes or no, right? So it depends on which perspective you take, right? So in sort of the science of depression, we run clinical trials. In clinical trials, they'll compare antidepressant medication to a placebo, and a medicine that's a medicine in every way, except it's not built with a specific antidepressant mechanism in it. And then when antidepressant medications beat the placebo, we say they're effective in group data. Okay, that's one way to look at it. Does it mean effective for you? Not necessarily. We know in the group data, some people do very fine. They benefit, let's say. They improve. They come in depressed, they begin medicine, they take it for a time. Their symptoms of depression are alleviated, they get back to normal life. At some point they come down on the medication, life goes on, they're fine, they're sort of back on the road again. And so that's a success case, right? But in that same group of those people in the clinical trial or in clinical practice, there'll be people who take this medication for a long time. They don't get better. They have side effects. They don't like the side effects. They are afraid that if they come off the medicine, their depression could get worse or could come back. And so they remain on it. They're kind of in a gray zone. Are they better? Are they not better? Probably not really better. That's a group. There's another group who take the medications, don't tolerate them, stop using them. And some who take them, one doesn't work, add another one, now they take two, add CBT, now they have three things. Even with multiple therapies, maybe they don't benefit. So there's many different individual people in the groups of data where when the data says that on average people got better, there's some people who didn't. And there's a lot of different mixed results in there. So yeah, so it depends on what people want to know is it going to help me? That's hard to say. It's a kind of a probability judgment. It's a probability judgment based on knowing that in groups of people who are probably similar and different from you in many different ways, people on average get better. It's hard to take that and that evidence collected that way, interpreted that way, and to take it in to say what it means for you. So I think a reasonable version of the story that science doesn't quite yet tell us is the evidence, is that, practically speaking, different people are going to benefit from different things. Some people will benefit from medication, some will not. Some will benefit from one kind of psychotherapy, and some will not. Some will benefit from a different psychotherapy where some other people in the same cohort will not. So some people may not benefit from anything, frankly. That's sort of I think that's in the circumstances in reality. So the science doesn't yet tell us what I just said, but I think it's reasonable, and it's a fair assumption from what we know that different people are different and they need different treatments. Unfortunately, our approach to things like depression and anxiety and other health conditions, all health conditions, is if you have a diagnosis, we need to find the treatment for that diagnosis. And when we run the RCTs, that's how we find what the treatments are going to be. Then when you wind up with that, you go and look at what came out of the RCTs, and that's what you get. Okay, people are not just a diagnosis. people may be given a diagnosis, but people are complicated. They have unique learning histories, unique family histories. They're obviously different genetically and in terms of, how their brains work, how their bodies work, how they experience depression, how they respond when they experience depression. Everyone's different. So while the evidence isn't quite there yet to give us a way to, scientists call it phenotype, identify what sort of person you are by measurable features, surface features of what you're like. The science isn't telling us yet what many scientists think we need to know, which is how can we measure some things, learn some things about you, and then from that information identify precisely the best, most personalized, effective, and efficient treatment for you. I think many people, we think this is where our science needs to go. So far, our scientific methods, randomized controlled trials, group data, add the people together, systematic reviews that synthesize all the data in the RCTs and get a summary result. These are a bit missing the point on that more personal side of it. What does the individual need based on everything we know or can learn about them as a person? So that's this other perspective. It's reasonable, it's scientifically based, but not yet quite fully validated.